Hello everyone, my name is Anyango Esther and I will be presenting about the Kabete Rehabilitation Center project for the BSI Nairobi chapter. The BSI Nairobi chapter was officially formed last year on 7th June 2017. It currently comprises of 37 members who are medical, dental, and pharmacy undergraduate students at the University of Nairobi. Being a part of BSI Nairobi was a very exciting experience, and in line with the overall BSI objectives, BSI Nairobi was formed with the aim of making a difference within the surrounding community we planned to do this by promoting student participation in general public healthcare and well-being through mentorship programs. And so mentorship is very fundamental to BSI Nairobi. As our first project, we undertook a project on 30th July 2017 with the aim of establishing a mentorship program at the Kabete Rehabilitation Center in Kenya. The project also sought to outline some of the challenges faced by students in the institution. A little bit about Kabete. Kabete currently is a rehabilitation center that is run by the government, and it's an approved school set in the lower Kabete area of Nairobi County. It was first built between 1910 and 1912 to cater for youth who had been imprisoned for failing to register themselves or their inability to carry their identity cards. However, later on in 1934, Kabete Reformatory was converted into an approved school to further increase its efficiency and capacity in dealing with juvenile delinquency. Currently, it hosts boys aged between 11 to 18 years who have been in conflict with the law in one way or another. The highest number of boys admitted are due to truancy. They just do not want to go to school. The center aims to reform the boys by addressing the root of the problem, giving them a basic education and vocational training while trying to keep them off the streets. It has a capacity of about 120 boys. The maximum sentence or the maximum term served at the center is 3 years. The day on 30th July was a huge success. As BSI members, we received a very warm reception by the boys. The boys were evidently very eager to learn and asked very many questions, especially on the area of HIV/AIDS and drugs and substance abuse. Many of the students opened up very easily when speaking about their experiences, many of which were very traumatic and very, very, very tough. There was an evidence of a process of transformation among the students at the center. They showed acceptance of their past and their current situations and were willing to change and become better individuals in the society. And so this was very, very encouraging. The challenges that we enumerated on that day or that we outlined were very, very many. However, I will just focus on two major challenges that informed our follow-up visit. Two challenges stood out. The first one was exposure to drugs at a very young age. Many of the boys confessed that they were exposed to drugs and alcohol at a very, very tender age, and this they confirmed has derailed their education and contributed to their truancy. Drug addiction, some of the boys insist that they cannot live without drugs, and those who are addicted to drugs even still find a way to access the drugs even within. As a result, an assessment focusing on the knowledge, the attitude, and practice of drugs and substance use among teenagers in Kabete Rehabilitation School was carried out. Ultimately, the aim was to propose strategies to mitigate the lowering in age of first use of all drugs. As a brief introduction, drug abuse can be defined as the compulsive, excessive, and self-damaging use of habit-forming drugs or substances that leading to addiction or dependence. It happens to be one of the major problems that Kenya has to deal with on a daily basis, especially among the youth. Ever since 2001, cases of minors abusing drugs or getting arrested or losing their lives or becoming sickly have hit a considerable high, and it is therefore necessary for all efforts to be channeled toward mitigating this upward trend. Findings indicate that the median age at first use of all drugs has dropped to as low as 10 years. 10 years, according to me, is a very, very tender age for any young person to get involved in drugs and psychoactive substances. The teenage years are vital, and it is a time when habits are forming, and evidence has shown a direct correlation between early exposure and later dependence and addiction to drugs and other psychoactive substances. The method that was collected was quite easy. It was collected from standard 5 to 7 pupils. That's about 10 to age 13. Actually, standard 5 to 7, sorry. That's standard 5 to 7 pupils at the Kabete Rehabilitation School. And in-depth interviews and focus group discussions were used. A total of 83 teenage boys took part in the overall assessment. Information assessed include current age at their current ages during the their current ages, commonly abused drugs, age at first abuse, reasons for abuse for the first time, common times and locations of abuse, common routes, and the general knowledge of the effects of drug abuse. The findings indicated that their current ages was 14 to 15 years, and this is 60 of the boys. 60 of 83, that comes to about three-quarter of the boys were aged between 14 to 15 years old. Commonly abused drugs, alcohol stood out to be the most abused drug, followed by bang, then tobacco. Cocaine came in fourth. Glue was very common, especially among homeless street children. Cat, illicit brews. The average age at first abuse was seen to be 10 years. Reasons for drug abuse varied, but the most that stood out was peer influence. Many of the boys attest that they abused drugs because they were influenced by the peers wrongly, and this was the major reason why the young people abuse drugs. Tension in the homes. A good number of respondents who resorted to drugs did so as a way of dealing with the stresses in the home. And because drugs provide a false sense of feeling that everything is okay, then it was better than them having to deal with the issues that are presented to them at home. Many of the teenagers also came from broken homes with just a single parent, or actually no parent at all, and so there was a lack of parental guidance, a lack of a role model, and positive traits and habits were never instilled in these children, which led to them making poor decisions, one of which was trying out drugs. Abandonment and homelessness. Some of the boys who resorted to drugs do not have homes, and so resorted to live in the streets, where drug abuse is a common way of just passing time. Many of the respondents came from disadvantaged backgrounds with a low economic status, and there's a perceived lucrative nature that is associated with dealing drugs, because the young people believe that dealing drugs will actually make them rich, and because they do not want to be rich all their lives, then they have resorted to dealing with drugs just to help them not become poor like they already are. Recreation. The boys consider drug abuse to be a form of recreation whose thrilling effect is unparalleled. Boys would rather abuse drugs than play soccer or read or watch a film. And because of the intense amount of energy that comes about with being a teenager and being a young person, it seems that all their energy is being channeled towards abusing drugs rather than doing things or activities that will positively impact their futures. There's a lot of ignorance surrounding drugs and substance abuse. Some of the boys do not know, have no idea what drugs are, or even believe that drugs are harmful to them. They say that they have never seen a young person getting affected by these particular drugs and substance abuse. They claim that drugs and other substances can have therapeutic effects against various diseases, for example, a common cold. And so it was very worrying. The level of ignorance was very, very worrying among the boys. Common times and locations of abuse varied from morning to afternoon to the evening, and this happened in secluded places or even at home. Common routes of drug abuse, the oral ones stood out, the nasal airway, which is inhalation, and parenteral, which involved injecting of drugs into the bloodstream. Knowledge of the effects of drugs. Generally, there was a very scanty knowledge about drugs and their harmful effects. The conclusion, there is an evident inadequacy of knowledge about drugs and their effects among boys at Kabete. The causes of initial drug abuse are multiple and complex. Solution to this drug problem requires a multidisciplinary approach. Some of the recommendations that we have given is that number one, public education campaigns should increase. In 2001, when Kenya realized that drug abuse was a major problem for it, it established an organization known as the National Campaign Against Drug Abuse, NACADA, in early 2001. This organization was charged with the responsibility of coordinating activities of individuals and organizations in the campaign against drug abuse. Its mandate was to initiate public education campaign and develop an action plan aimed at curbing drug abuse by the youth. NACADA has done an awesome job at creating awareness about the harmful effects of drug abuse. But more still needs to be done because evidently there are some young people who have no idea what drugs are and what their harmful effects are. And it's a community problem whereby not only NACADA has the mandate, but each and every one of us is affected by drugs and substance abuse in one way or the other. And so public education campaign needs to really, really be something that each and every single person takes part in. Sensitization of parents on the drug abuse practices of the youth. Parents need to stop burying their heads in the sand, and they need to realize that the young people are actually abusing drugs. And so parents need to be taught on the symptoms or the things to look out for to actually realize that their children are abusing drugs. They need to be taught or reminded about their role as role models and inculcate positive habits in their children. Drug prevention interventions needs to be incorporated even into the curriculum very, very early in life, so that we don't have instances whereby a child is 15 years old and does not know what drugs are. School children also need to be encouraged to help their fellow children keep away from drugs. Owing to the knowledge that has been given to them, school children need to be in a position whereby they can influence their fellow students not to abuse these harmful drugs because drugs are actually indeed harmful to their health. There is a need for counselors. Teenagers these days undergo very traumatic situations, very, very tough things, and it is important that they learn to channel their frustrations in other ways other than using drugs. There's a need of counselors and social workers to help talk to stressed out teenagers or boys or young people, just to help them talk out their issues and relieve them of the stresses that they undergo on a daily basis. Government poverty reduction strategies. This will help raise the economic status of the poor and will, I believe, curb drugs and substance abuse, because one of the main reasons why the young people abuse drugs is because of the low economic status. And when they look at people who abuse drugs, then they think that is how they get money. But that is really not. They will harm their health, and so that should be one of the strategies that will help towards mitigating this trend.